So hello, everyone. My name is Andrea Molina, and I'll be assisting Dr. Garcia today. We're going to be talking about the non-surgical eye lift with NDI, RF with microneedling. So welcome, everyone. Before we start, I'm going to welcome you to write down any questions that you have on the Q&A tab down below, and we'll be answering them at one point on the presentation. So today, this is our guest, meet our guest speaker, Dr. Rene Garcia. He's an Hi, doctor. So he's an internal medicine physician who specializes in aesthetic medicine in Coral Gables, Florida. Dr. Garcia has trained internationally, including in the USA, UK, and Mexico. He has a large practice in neurotoxins and fillers, and the EndyMed is his favorite platform because he loves the natural results. Now, before we get started, we're going to do a poll check, which I'm going to open it right now. And there's going to be 4 questions for you. Please read them carefully, and we'll give you a couple minutes for you to answer them. So the first question is, are you currently treating for nutrition and or weight loss in your clinic? So yes, no, but I plan to. Number 2, what treatments are you currently offering to combat skin laxity post weight loss? Question number 3, have you noticed an increase in patient demand, a desire for skin tightening post weight loss? And finally, number 4, what areas of skin laxity and sagging are you most interested in treating? So I'm gonna give you a couple more minutes to answer the questions. We got 30 out of 50. We're almost there. Have 36 out of 52 participants that have responded.
Well, it looks like we have a diverse audience here.
Okay, we're gonna continue now. So open your eyes to new opportunities. Eyes are one of the first areas to show the first signs of aging, which is why there's a high demand in the market for eye lift. And 70% of the consumers are bothered by fine lines and wrinkles around the eyes. And the demand for eye lift surgeries has almost doubled in the past 5 years. Now, these are some of the external aging concerns in the periorbital area. We have the eyebrow and upper eyelid descent, the lower eyelid drooping, the appearance of under eye bags, wrinkles appear under the lower eyelid, and crow's feet start to appear. These are the challenges that patients face. They have delicate skin around the eye area, and it's really hard to reach. And they also face multiple concerns with laxity, fine lines, and wrinkles. Now we'll be talking about how NDI works. So NDI offers a unique combination of 3 powerful technologies all on the same platform. Uses iFine, Intensive, and FSR. And this is a series of 3 treatments, all done at 1 month apart. Now we're going to be speaking about the treatment protocols, and we'll be bringing Dr. Garcia in for him to explain all of them. Dr. Garcia, can you hear me?
Yes. Hello, everyone. So we're going to talk about treatment protocols. we're going to start with the NDI iFind. This is one of the handpieces that conforms the platform of EndyMed. This is a 3D focused radiofrequency or isolated radiofrequency. This is a very nice area to treat the periocular area because this is a small handpiece that is going to be able to reach very small and remote areas around the eye, okay? So we can do a treatment in one side in just 2 or 3 minutes. We usually do average 8 to 10 passes in the lower eyelid, another 8 to 9 to 10 passes in the upper eyelid. So the goal is to provide a smoother and tighter skin around the eyes to improve sagging and laxity of the surrounding area from the eye. It will give you an appearance of more youthful and less tired looking eyes. The following handpiece that conforms this platform is the NDI Intensive or radiofrequency with microneedling. This handpiece has 25 needles, gold coated, and the technology that it uses is the 3D RF microneedling. In the specifically for the periorbital area, it has a max depth of 1.5 millimeters. And this is a presetting that the machine will give you. So one of the advantages that this machine has is that already will give you the presettings. So it's a very, very friendly platform to use. It will create a localized microinjury that generates a skin remodeling and collagen regeneration. Remember, guys, that after 25 years old, we start losing collagen. We have a bank of collagen. We start losing after that age. So the goal is to bring it back, okay? So the effective for treating fat pads at the infraorbital area as well. The other handpiece is the NDI FSR or fractional skin resurfacing. This one uses a 3D technology as well that is patented by EndyMed. This will cause a mini ablation of the epidermis. As a result, will give you a skin rejuvenation and a glow effect. This is designed to treat fine lines, fine wrinkles, and also scar tissue or surgical scars in other areas of the body, including the face.
Okay, this is the time for questions and answers. It looks like some questions have come in for Dr. Garcia. So Dr. Garcia, how many treatments do you do with your patients?
In my experience, EndyMed suggests 3 treatments as a base, but in reality, my experience is that you can extend a little bit more. It depends of the aging process that the patient is, but it can be from 4 to 6 treatment in my experience.
Perfect. So
You have to do a treatment, 1 treatment per month, okay? And it takes up to 4, in my experience, up to 4 or 6 months to see results. Remember, this platform is designed to give you natural results. The aging process doesn't happen overnight. So as well, in order to produce collagen or stimulate collagen, it will take a few months, but this is a very nice platform to provide natural results.
Perfect. And can you also comment on the downtime?
That's one of the beauties of this platform, the downtime. you can have the procedure, you will see redness, a little bit of inflammation that would last just a few hours. I never had any complications with this platform of EndyMed, and my patients the following day can go back to work easily, okay? There's minimum inflammation. It is very noticeable after you finish the treatment, but magically in a few hours, the inflammation goes away. And you can go back, almost back, the skin is going to be almost back to baseline in a period of 8 to 12 hours.
Perfect. Next one I have is, how do you decide to do the NDI treatment for patients?
So when 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 you are practicing and you have a base of you have your patients, okay? You will start hearing patients concerned about at different stages, okay? At different ages, you will see your mid 30 patient, your 40-year-old patient, and your 50-year-old patient, okay? So the beauty of this platform is that you can make individualized protocols for each patient. So one of the common concerns that I hear from every patient is a skin laxity, okay? Especially in the lower part of the eyelid. Another concern is fine wrinkles or fine lines. Those are the main concerns that you can hear from the patients. We have also millennial patients that they want to do preventive treatment. So NDI, the handpiece of NDI, the pure or isolated radiofrequency, this is a good handpiece for prevention, okay? We suggest to do 6 to 8 treatments, okay?
Perfect. Do you also use any numbing cream before the procedure?
Yes, with the NDI, with the isolated radiofrequency, you don't need any numbing, okay? But with the intensive, the radiofrequency with microneedling or the FSR, you need numbing. We use BLT 20%, 10, and 10. And this is a good topical anesthetic. And it depends of the patient, but most of my patients no complain of pain or mild complaint of pain. So this is a treatment that is very well tolerated, especially in the periorbital area.
Perfect. And what products do you recommend post-treatment?
So you can use, you can use different products, okay? MDPen recommends a protocol that contains hyaluronic acid, growth factors, and copper, okay? Also, in the literature, you can use also other components like exosomes. You can use PRP, and you can use drug delivery with vitamin A, vitamin C, okay? This is why you have to evaluate your patient, do the right diagnosis, and treat accordingly of the patient needs, okay?
Another question is, can you talk about the energy in watts that you use with iFind?
Okay. Remember, guys, we have two EndyMed platforms. We have the EndyMed Pure and we have the EndyMed Pro, okay? The EndyMed Pure will give you it's very friendly to use because, for example, you select the area and we'll give you a setting of how many watts you're going to use. Specifically for the iFind, you start with 3 watts and you can manipulate the machine. You can increase the watts or you can decrease the watts, okay? If the patient tolerates the procedure well, you can increase it a little bit, per session, the energy, okay? A difference of the EndyMed Pro, you have to set up the settings. In my practice, we have the EndyMed Pure, so the settings are already there, and almost any person can use it, okay? An esthetician and a physician, okay? And it's a very, very friendly, and that's one of the reasons that we decide to buy this EndyMed platform, the EndyMed Pure, because of the facility and because the machine is very friendly.
Excellent. And Dr. Garcia, can you tell us how long the effects last and are there any follow-ups needed?
Can you repeat the question, please?
How long do the effects last and are there any follow-ups needed?
Okay, yes. So another good thing of using radiofrequency is that it gives you long-lasting results. We have research that is done by EndyMed of long-lasting results up to 2 years. And we are going to show it in the following slides. But you are going to evaluate. So in my practice, what we do maintenance, okay? After we finish the series of treatments, we do a maintenance of of one treatment with intensive every 6 months. And why is that? Because the aging process continues in every patient, okay? So even if you do your series of treatments, the aging process continues, so you have to keep maintaining the patient.
Okay. And can you also speak to the skin types on the Fitzpatrick scale for which this is suitable?
Yeah. I'm glad that you guys asked me this question because in my personal experience, so I start with injectables, okay, with Botox and fillers. And when you're going to integrate an energy device in your practice, okay, having a platform like EndyMed is good for 2 reasons, because you can treat every skin type. You can treat from Fitzpatrick 1 to Fitzpatrick 6. That means you can treat white people, you can treat brown people and black people with no effects, okay? In my practice, or looking at other webinars or the feedback from other physicians that own an EndyMed machine, I never heard any complaints about any side effects. So this is a good platform to start because you can do a variety of things in a variety of skin types. And not only that, the platform has different hand pieces. So you can use it beside the periorbital area. You can use it for skin laxity in the neck. You can use it for acne scars. It is very popular for acne scars, for surgical scars after a breast implant or after tummy tuck, for example. That's one of the common things that we have in our practice. Also for maintenance, okay? You can see the young patient in the mid-20s, early 30s, that start seeing a little bit of saggy skin, and they want to delay that aging process. So for that, we have a protocol for intensive, and we start with 3 treatments, separate 1 treatment per month.
Perfect. And now our last question before we jump into the demo. How long can you treat after Botox or fillers?
Usually in my practice, before I do Botox or fillers, I recommend first the energy device. I recommend to finish the sessions, at least 3 sessions, and then I start doing any injectables. Why? Because the expectation is to see improvement of the aging process, so you can minimize the use of this. Can be Botox or can be fillers. Once you feel like you need for example, in the case of fillers, once you feel like you have to complement with a filler, you go and you do it, okay? But not before. So in my practice, we always do a treatment with energy device, in this case, EndyMed, and then we recommend Botox or fillers.
Perfect. We'll be continuing with our presentation. To the next slide. Okay, so these are the before and after photos. Doctor, can you explain us?
Yes, before and after pictures. Okay. So we don't have the age of the patient here, but remember, guys, we can treat patients in the late 20s, early 30s, 40s, or 50s. Okay. Of course, if the patient is younger, results are better because the bank of collagen is higher. Okay. So in this case, this is after 6 treatments or E-fine, and the before picture show a significant laxity of the lower eyelid with significant amount of wrinkles, okay? These are static wrinkles. You see a little bit of edema that with E-fine will improve it because it will improve the drainage through the lymphatics, because you're going to do 6 to 8 passes with different sessions. In this case, after 6 treatments, you can see the after picture with a significant result. So we're going to go to the next slide, okay? So this is E-fine, okay? This is a before picture, and the after picture, you can see a significant improvement. This is malar edema. In my practice, once we see this, okay, besides recommending E-fine, we recommend at least 3 sessions of intensive. This is radio frequency with microneedlings, and we can achieve this type of results. And in this case, is 4 treatments, okay? But I think probably in this patient is not documented here, but probably in this patient had also intensive. We're going to the next slide, okay? Okay, so this is another treatment with E-fine. In the before pictures, you see a static wrinkle and a skin laxity, okay? Probably this is a mid-30-year-old female patient with a significant result after 5 treatments. This is a combination. So in the protocols, depending of the patient, okay, also depending of the budget, okay, you are going to start combining these treatments. You can do E-fine, and in the same session, you can do FSR, or you can do E-fine and intensive, okay? And still, no side effects using this combination, okay? So this is before picture and after 3 month after picture. This patient, as you can see in the before picture, has lateral crowd feet static wrinkles, okay? That probably this patient is not going to be a good candidate to have botulinum toxin. So this is why I recommend in these patients to start with iFine. Also, FSR will improve. Remember, FSR is like mini ablation of the epidermis, so will improve fine wrinkles or fine lines. Okay, deep wrinkles, you know, it may not give you the best results, but for fine lines or fine wrinkles, it's an excellent procedure. This is FSR, okay? The same before picture and after three treatments, okay? You will see an improvement of static wrinkles in the crowd feet, okay? And this is a combination of iFine and an intensive RF microneedling. Remember, you always start with the iFine. After the treatment, you can go away. You can put topical anesthesia, okay? And then you do the intensive RF, okay? So the procedure may last probably, you know, iFine is very quick. You can do it in 2 or 3 minutes. The intensive itself is a very quick procedure, less than 10 minutes probably in one side. But what it will take longer is the anesthesia, okay? Probably you have to leave the topical anesthesia for 30 to 40 minutes, okay? And it depends on the patient, okay? So this is after 2 treatments. This is a combination. Also, you can combine intensive RF with microneedling and FSR. First, in my practice, we do the intensive RF, and then we do the FSR, okay? In this case, when we do this combination of treatments, the downtime is a little bit more prolonged, okay? It's not much, you know, but it can take a few days, okay? Especially because the FSR can cause a little bit of more swelling. But the patient can go back to work and can do regular daily activities. The only thing that I recommend after the treatment is not to have sun exposure and not immediately after the treatment, but the following day to use SPF.
Okay, so next up, we're going to be transitioning into the live treatment shortly. We're just going to give Dr. Garcia a few minutes for him to get settled and going to the surgery room.
We already put anesthesia, topical anesthesia, BLT in this patient. We leave it for 30 to 40 minutes. We're going to cover one side only because of matter of time. So first, you know, remember guys, you have to get consent. Then you can take your before pictures to document any future changes. Then you apply the topical anesthesia and you remove it, okay? In this case, to make it practical, we put anesthesia before doing any procedure, but we're going to use the iFine that in a normal scenario, you don't need a topical anesthesia, okay? So just let me show you the machine very quick, okay? So we have 2 hand pieces here and we're going to start with the iFine, okay? So you select face, it will give you the picture of all the hand pieces. We have the iFine, we select the iFine, okay? In the right column, okay, you can select the areas. In this case, it's going to be the periorbital area, and it's going to give you a setting of 3 watts, and that's what we start always, okay? Also, it will mark the passes So if you are, very focused in your treatments, okay, the machine will tell you how many passes you are doing, okay? Right, patient, we're going to start. Renata is a early 30-year-old female patient, and one of her main concerns are fine lines in the lower eyelid and also some dynamic wrinkles when she smiles, okay? So for this patient, she's in an early stage of the aging process, and I find intensive and FSR is going to be a good protocol for this patient. You have to, something that I skip, okay, you have to always put some gel, okay? Because otherwise you are going to burn the patient, or at least the patient will feel like it's getting burned, but this is a nice technology that will respect the epidermis, okay? So you have to put plenty of gel, okay? You do like 3 preheating passes. And 6 to 7 additional passes for treatment, okay? You have to ask the patient if they feel anything, okay? Pain or any burning sensation. In this case, we put topical anesthesia, so probably the pain is not going to be there, okay? But I recommend you to do it without anesthesia so the patient can warn you, okay? Everything okay?
Yes.
Yes. You have to keep moving this device because if the device is static, the patient will feel it, okay? And it's not a pleasant feeling, okay? But in my experience, even if the patient complains, I just move it, the pain goes away very quick, and there is no damage in the skin, okay? So you can, let me see if we can capture, but the machine is recording how many passes we're giving, okay? So we're in the 3rd pass right now. Just for educational purposes, we're going to go to another area so we can cover in reality what other areas we're going to cover within the eye, okay? Close your eye. The feedback that I get from the patients after we are done with the E-Fine is a immediate lifting effect when you compare with the opposite side, okay? And I'm going to lower the bed a little bit, okay? Is that okay? You can always change your handpiece in order for you to feel comfortable. If the machine is not or if the handpiece is not making contact with the skin, the machine will not run, okay? It will stop and an alarm will make a noise. So it's one pass. This is another pass. Always you have to do it over bony surfaces, okay? You cannot do it in the eye, you cannot. So we're going to start pass number 6. 3 in the upper eyelid, okay? So radio frequency will stimulate collagen, okay? So let's imagine that we finish all the 8 to 9 passes. Then we're going to go up above the eyebrow, okay? And this is the one that will give you a nice lifting effect. So if the patient has a recent application of Botox, okay, there is some controversy that the Botox the botulinum toxin can wear off a little bit faster. So this is why I always recommend to do it before any injectables. Okay, we complete a total of 9 passes, okay? I'm going to change the handpiece. But before, I have to clean the patient. All right, are you okay?
Yes.
Yes, okay. So after the E-find, there is a little bit of redness. That's totally normal, expected, okay? Don't worry about it. Depending on the protocol that you use, okay? Depending of the practice, depending of the physician. Before you do the microneedling with radiofrequency, you can use your own preparation for drug delivery. It can be MD Pen products, but also some other physicians use a combination of vitamin C, vitamin A, okay? Or you can use exosomes or growth factors in order to improve this area, okay? So I'm going to change the handpiece. And so we're going back. We're going to use the fractional device, the handpiece. We use the intensive, we have the FSR. And intensive, we in this column, okay, we have the areas that we're going to treat. We're going to choose the periorbital area. It will give you a low energy at level 1. It will give you a presetting of maximum of 1.5 millimeters. The machine has a capacity to go deeper, 3.5. You can modify that depth, but the machine for this specific area recommends 1.5. I almost never go, go deeper of 1.5 in this area, okay? Because this is a very delicate area. And if you respect the settings, I'm sure you're not going to have any complications or any side effects. Also, you can use it in continuous mode. I love this application because it goes faster, okay? Okay. We already put the tip. These are 25 gold coated needles, okay? These are sterilized and these are used individually for each patient, okay? You cannot use the tip for another patient, from another patient, okay? This is very important. The system is very smart. It has a coagulation system, so bleeding is going to be minimum, okay? Okay, we're going to start with intensive, okay? Okay. I always overlap the tip. I always retract the skin, make sure that I'm on the bone, okay? Around the area, you cannot do it in the soft tissue, okay? Okay, you can see minimum bleeding, okay, because this device delivers the energy, but always won't respect the epidermis in terms of delivering the heat. So we basically finish with the intensive. At this point, in this patient, I will use the MDMed products, okay? Right now, I'm going to use the growth factors. So there is going to be some absorption, okay, but I'm going to dry the excess. And when I always do this procedure, I always have to go from the intensive to the FSR. And one of the things that interfere with your procedure is that you have to do a change in the handpiece. Okay, so I have the FSR in this box, okay? I will open it very quick. I have to use the tip, the disposable tip that we have been using for Renata. For this handpiece, I always cover it because it delivers a smell of burning, okay? And I have to change the settings. We go back to ablation, we choose the FSR. We choose the area. In this case, it's going to be the periorbital area. We will give you low energy level, level 2. Okay. The machine will let you know how many per tip, how many pulses are left, okay? In this case, for the FSR tip, will give you 450 pulses, okay? I didn't mention, but for intensive, each tip will give you 1,000 pulses, okay? So basically, you can use probably with face and neck around 800 pulses, okay? For the FSR tip, the tip is going to last longer, okay? The average tip cost is around $100 average, okay? Just to mention, okay? That. See? We're going to start, okay? And I want to go to the other side. Are you okay? Yes. Okay, can you smile to me? Okay, all right. She has minimal fine lines, okay? So I'm going to cover her CrossFit. Okay. This tip covers a larger surface area, so you can do treatments faster than the intensive, okay? And basically, you can cover this area. Basically, we finished, okay? So I usually don't cover the whole eye if there are no fine lines or wrinkles for this treatment. I go specifically to the treatment area that I wanna treat, okay? After that, I put something to absorb. In this case, is going to be growth factors from MD Pen, okay? I instruct the patient to leave it for at least 8 hours. And after 8 hours, it can get reabsorbed. It can get reabsorbed and they can wash their face. Okay, we finish and we're going to the other room.
Thank you so much for that, Dr. Garcia. Here's a QR code where you can learn more about the procedure, and you can schedule a call or demo with one of our specialists. Next up, I saw there were a lot of questions on the chat about pricing, so we're going to talk about them. So the NDMed Pro NDI platform with iFine intensive RF microneedling and FSR hand pieces. There's an exclusive limited time offer, so I would take advantage of this special promotion. The retail price is $154,000 with 8,800, and promotional savings are $45,800. So now you could get it for $109,000. There's also a flexible financing purchase option at just $2,300 a month for a 16-month term. And you can enhance your practice without any upfront cost. The next one is the MDMed Pure platform with iFine intensive RF microneedling and FSR hand pieces. We also have a promo on this one. The retail price is $106,000 with 700. You could save $32,000 with $800, and you could get it for $73,900. There's also a flexible financing option at just $1,500 a month. And next up is, here is a QR code where you can schedule a demonstration. You can schedule it or email or phone directly in the chat. So one of our product specialists can contact you or call us directly at 888-313-1415. I'll give you a few seconds in case you want to take a picture of the QR code. Thank you so much for coming, everyone. There's also going to be, MD is going to be having a hands-on workshop in Atlanta, Georgia on the 27th of April from 8 a.m. to 5 p.m. So in case you want to come and attend, it would be great. Doctor, would you like to say bye to everyone?
Thank you everyone for listening. It was a great experience. Thank you for MD Pen for the invitation. Okay, and if you guys have any additional questions, you can let Andrea, and she will pass those questions to me and I can answer it. Okay. Thank you so much. Have a good night.